Are you curious about berberine, what it actually is, and what the research says about it? It's one of the most talked about supplements right now, so let's break down what you need to know. Berberine is a natural yellow compound, an alkaloid, extracted from plants like barberry and golden seal. It's been used in traditional Chinese medicine, Ayurvedic practice, and Native American healing for thousands of years, mainly for digestive complaints and infections. Today, in the UK, it's available as a food supplement, and that's an important distinction. It is not a licensed medicine. So, what is it actually being studied for? The most researched areas are blood glucose management, particularly in relation to type 2 diabetes, cardiovascular health, including cholesterol levels, and gastrointestinal conditions. Research suggests there may be potential benefits for what's called metabolic parameters, but to be clear, berberine is not included in NICE clinical guidelines, and it should never replace any prescribed treatment your doctor has given you. In terms of how it works, berberine activates something called the AMPK enzyme pathway, which plays a role in how the body processes glucose and fats. One thing worth knowing is that berberine has very low oral bioavailability, meaning only a small amount of what you take is actually absorbed. This is one of the reasons the research picture is still developing. Now, side effects. The most commonly reported ones are gastrointestinal, things like diarrhea, cramping, and nausea. These tend to be dose dependent, meaning they're more likely at higher amounts. Drug interactions are a particularly important consideration. Berberine affects enzymes in the body, specifically CYP45, O enzymes, and a transporter called P-glycoprotein, which means it can interfere with how other medications are processed. This is especially relevant if you're taking diabetes medications, anticoagulants such as apixaban or rivaroxaban or statins. If you're on any of these, please speak to your doctor or pharmacist before considering berberine. There are also clear situations where berberine should not be used at all. It is contraindicated during pregnancy and breastfeeding and should not be given to newborns. If you have liver or kidney disease, extra caution is needed. And if you're due to have surgery, berberine should be stopped beforehand. Your healthcare professional can advise you on the timing. One more thing worth mentioning. Because berberine is a food supplement rather than a licensed medicine, product quality and strength can vary between manufacturers. It's worth seeking advice from a pharmacist and choosing a reputable brand. If you're thinking about berberine, here's what's worth discussing with your doctor or pharmacist. Whether it may be appropriate for you given your current health conditions, whether it could interact with any medications you're already taking, and whether it fits alongside, not instead of, any existing treatment plan. A few key takeaways. Berberine is a food supplement, not a licensed medicine, and it doesn't replace prescribed treatments. Research into its potential benefits is ongoing, but the evidence isn't yet strong enough for it to feature in UK clinical guidelines. And because of its interaction profile, checking with a healthcare professional before starting it really is essential. If you found this helpful, drop a comment below. We'd love to know what topics you'd like us to cover next. And if you want more straightforward health information like this, make sure you like this video and subscribe to the Bolt Pharmacy channel.